Welcome to our Lively You Virtual Learning Academy. On behalf of the Wood County Committee on Aging, we welcome here today Michelle O'Brien and Lauren Gurich from St. Luke's McLaren. They are pharmacists there and will present information on medication safety.
Perfect. Thank you so much for having us. So my name is Michelle. I am a pharmacist here with the Family Medicine Residency Clinic. So I'm always stationed here. And then Lauren, she's our pharmacy resident. So she's going to be graduating in, 19 days? Yes. So she's got 19 days left of her residency training, and then she's moving on. And we'll have some new ones that will be around talking to you next year. So today we wanted to talk a little bit about medication safety. Since we are the pharmacists and we are the holy medication experts. So after today's presentation, you should be able to discuss the importance of an accurate medication list, determine how to properly store and dispose of medications, and explain the importance of medication adherence. So first, we're going to dive into medication lists. You know what? I don't know if I screen share it this way, if our animations will work. Let me pause for one moment. We'll just go with this. I don't think we have much in our comments. Okay. So for our medication lists, we encourage everybody to have one handy with you wherever you go, in particular to your doctor's offices. So keeping one in your wallet, in a purse, at home, easy, so that you can set up your medications. But the important things to have on your medication list are the name of the drug, the strength of the drug, which is very important, how you take it. So what we mean by that is, do you take it one tablet? Do you take 2 tablets? And then what time you take it. So when you take it, is this a morning medication? Is this a night medication? Do you take it 3 times a day? And do you space that out, before breakfast? Is a little bit before breakfast, before lunch, before dinner? So kind of organizing that so that we would know, if we were looking at that med list, do you take all of these in the morning? And do we worry that maybe taking some at the same time can interact with each other? So being very explicit about how your medications are organized is very important, and it allows for us to help you maximize and get the most benefit out of your medications. And then the other important piece that we like to hear too is why you take your medications. So we catch this a lot, that people just have meds on their list and they're not quite sure why they're taking them. But part of that is kind of empowering our patients to be advocates of their own health by looking and saying, well, I take these for XYZ, and then we can keep things organized for you. So we always encourage you to know why you're taking them, because then if you understand kind of benefit from taking it, it'll help with your compliance and taking it on a daily basis. And then who prescribed it. So that's particularly important when you're seeing multiple different physicians and your family doctor is looking at all of your medications and saying, well, these are coming from this doctor and that's coming from that doctor. And hopefully your family doctor can help coordinate all of that together. But then it would be easier for you to know too, that if you're running out of your medication and you need refills, who you would go to request those refills. And then it's also important to think about other medications that go on your list, like over-the-counter medications, herbals, and supplements. So oftentimes patients kind of breeze past these and think, oh, well, I should only include maybe the ones that are actually prescribed by my doctor on my list. But we know that there are many other medications that you can take. I know last time we talked about over-the-counter medications and how many and numerous that is if you go through the aisles at Rite Aid or at Walgreens or Kroger and see all the different medications that you could possibly grab off the shelf. So if you're taking anything routinely or even not routinely, so if things are seasonal and you only take your, say, Claritin or your Zyrtec just seasonally, it's okay to put that on your list too, but just write down when you take that. Or if you're thinking about pain medication, so this is one that often gets forgotten for discussion. is, do you take Tylenol for pain? Do you take ibuprofen or Advil for pain? So even though you don't take it every day, if you put it on your list, that's a good discussion point for you and your healthcare providers to say, what is the best medication to be taking if you have XYZ pain? So keeping in mind that those medications are important to put on there too. Multivitamins, that's good to add to your list if you take a multivitamin. In particular, one that near and dear to Lauren's heart is calcium and vitamin D, because she's done her residency project and her initiative was getting more patients on calcium and vitamin D. So writing that on your medication list, including the strength of that too, is very important because there's many, many different formulations of that. And the other important thing to think about is that just because it's an over-the-counter medication, they generally are safer to use, but that doesn't mean that they're completely safe or completely without side effects. And so it's important to think, if there is an issue that you're dealing with, if we have that comprehensive medication list, including all of your herbals and supplements, then we can look and see if maybe that's causing any of your problems. So anything to add? No. All right, so keeping that medication list up to date after your appointments is very, very important. So even if you want to, jot things in pencil, or if you have easy access to a computer and you can just update and reprint out your list so that you have it, that's very, very important. And like I had said before, keeping it in a wallet or close by, keeping, maybe a list, next to your phone or somewhere in your house is handy. I think that I should have looked this up, but I think do they say for EMS to
Refrigerator?
put it in the refrigerator? Yeah, like put it in an empty vial and put it in the refrigerator so that if the EMS comes, that they would know where to find that. Or like I said, in your purse too. Include any allergies on your medication list. So this is a really, really important one too. So thinking outside of just the medications you're taking, but the medications that you can't take because you're allergic to them, is a good idea to put on that medication list as well. So why is this all so important? Because we want to make sure, again, that we are comprehensively looking at everything that you're taking. One of the things that pharmacists specialize in is drug interactions. So we want to make sure that we're not missing something because a med's missing from your list. And again, keeping in mind those over-the-counter medications as well. So we always do generally advocate for you to get your meds all filled at one pharmacy. But sometimes we understand that, you might have to go through mail order. And if you're getting an antibiotic or a short-term medication, they say just get that filled at your local pharmacy. So that kind of makes it a little bit difficult for the pharmacist to look and say, well, is there any drug interactions if they don't have a comprehensive list of all your meds? So that's why it's important to bring that to your doctor's office so that they can scan through that. Food interactions, so that's a big one too. So sometimes medications need to be taken on an empty stomach. Sometimes they need to be taken with food. Sometimes different foods can, impair like your ability to absorb the medication. So sometimes, you can't take things with milk, or you couldn't take things with Tums. And so we want to make sure that we're getting ahead of the game on that so that you're taking your medications correctly and you're getting the right amount absorbed into your system. Optimizing therapies too. So depending on what disease states you have, there's important medications that like almost everybody needs to be on. And so if we're missing things, that's a good opportunity for your doctor to say, hey, like you have your list up to date, but this isn't in there. And sometimes we see this happen a lot when patients run out of refills and then they just assume that the medication is done and they're not supposed to take it anymore. And so that's always a good question to, gone up there, but that's always, there we go. It's always a good question to ask your doctor is like, how long am I going to be on this medication? Is this something that's short term? Is this something that I'm going to be on forever? And if there's no refills left, then does that mean that's the end? Or does that mean I need to call you and get some more refills for that? Accurate prescribing, some of the same thing too. So when we look at drug interactions and making sure that you have the right dose of everything. So if there was a dose change, like they needed to go say up on a blood pressure medication, that's reflected in there, and that we appropriately get rid of the lower dose and go to the higher dose. So making sure that we have an accurate list for that. Looking for side effects is the other important thing. So if something does pop up and you're not feeling well, you've got a headache, you've got stomach pains, you have leg cramps, something along those sorts, that if we have a full medication list, we'll be able to say, well, these are the most common medications that would cause this, so let's start investigating these first. So when we're looking for any adverse effects, it's good to have that complete medication list. Same thing for allergies as well. We wanted to kind of touch base on what we would call the difference between an allergy and an intolerance. So for an allergy is that your body is reacting to that. It's a hives, it's a rash, it's a throat closing kind of situation, versus intolerance is like, oh, when I take this medication, I get stomach cramps, or when I take this medication, I get a headache. Some of those things, while are cumbersome and maybe you don't want to use them again, we would call those more of an intolerance instead of an allergy. So the one last thing that we wanted to throw in here too is these medical alert bracelets. So these are really good, and I would encourage patients who have any like high risk medications, in particular insulin. So for our diabetics that are on insulin, anybody that's on blood thinners like Xarelto or Eliquis or warfarin, Pradaxa, I would say maybe even Plavix too, if you're on any of those medications. What else did we discuss?
Additionally too, like if you have any really like anaphylactic allergies,
Yes.
that would be really important to have a bracelet on in case something happens to you and EMS needs to know, oh, this patient is allergic to this medication and they have, that throat closure to this certain type of medication, so that they would know not to use it. So it's another way to indicate, your allergies as well as what you're on.
Yep. And so, so the reason why we encourage it is, if you say, heavens forbid, worst case scenario, you passed out or something, and we would need to know how to treat you. Well, if we saw on there, oh, this patient's a diabetic, well, that gives us a good insight of saying, well, is their sugar too low? Is their sugar too high? That's an easier way to start treatment if we know kind of what's going on with the patient. So I would highly consider getting one of these if you're one of those types of patients. Ooh. All right, so Lauren's going to transition here into medication storage and disposal.
So how many of you store your medications in the bathroom? Probably a lot of people. This is a very common area where patients can store their medications. And if you don't mind just clicking along, we don't want to store them in the bathroom. The bathroom is a place where that can be very humid. The temperature can change, based on if you're taking a shower or a bath or it's just a warm day. A lot of times bathrooms have windows too. So pretty much medications can be affected by all of these different parameters. So medications can be affected by humidity, by temperature changes, and even by sunlight. So that's usually why your medications may come in an amber vial or, kind of that thicker plastic to protect them from light. So to prevent any, changes to your medications, for safety and for efficacy purposes, the bathroom is not the best place to store your medications. We'll kind of talk about a few places to store them. So where we want to store them is a cool, dry place. So this may be, in your kitchen, maybe on your bedside if you feel comfortable with that, in your office, wherever you have space for it. But again, when you place them somewhere, make sure you don't forget about them. So, a lot of times you may put them in a cupboard. Make sure that you remember what cupboard they're in, or you make sure you take them every day if you have to take your medications every day. So we don't want to hide them too far away, but we do want to store them in a cool, dry place. So another example is to store your medications in what is known as a pill box. So this is just one example. There's a bunch of them that are over the counter with some beautiful colors. But this one's really nice because it separates it by morning, noon, and evening. There are some that are bigger that can store the whole month. There's some that can store a couple weeks at a time. So this is just a good place to store your medications so you don't forget to take them, which we'll talk about that part a little bit later in the presentation. But this is just a way to kind of set yourself up for the week. Make sure you stay up to date with your medications. We all forget every once in a while. So this is just one way. Oh, did I miss my lunch dose of something? So pill boxes are great. And we'll kind of go into those a little bit later. Another thing that you can do, depending on your pharmacy, is get them pill packed. So the pharmacy is able to pretty much put them in packaging for you, which is nice. As you can see on the screen, they separate it by, the timing of when you should be taking your medications. So depending on your pharmacy, you may want to request or see if they are able to do that for you. But this is just one way to help store your medications. And Michelle, did you want to add anything with this one?
Oh, yes. So if we would encourage you, if you decide to go through for this, that you're on pretty much a stable regimen of your medications, because it's really hard to change them once they're already packaged, because you usually get a month at a time. So we kind of reserve this, like once you're on a good, say, blood pressure regimen or diabetes regimen, that then we can go towards this if we're not going to be making a lot of major changes, because it is hard to get those changes in. But the nice thing about this too is that all your refills will be synced together. So it's not like you're calling the pharmacy every week to get a new med refilled, which I guess kind of tying into that, I wasn't planning on talking about it, but there are some sort of med sync programs too at some pharmacies that can kind of help you get all your medications synced so that you're getting your refills essentially at the same time or right around the same time of the month. So
and that's really nice. It cuts down on driving. It helps you, make sure you're picking them all up at the same time, and it's easier to keep track of them too. Mm-hmm. So I'm back to disposal. So there's a couple ways to dispose of your drugs. So every year there is a National Drug Take Back Day. If you guys have ever seen these, there are a lot of times at local fire departments, police departments, even hospitals or local pharmacies. They're usually around April and October. And so these are just places that you can look out for. A lot of these places do have, sometimes they have restrictions on what you can and cannot bring to them. But these are really good ways to dispose of your drugs. So that's just one option. Another option is some pharmacies or hospitals or even police stations or fire stations have a medication disposal box. So again, I always just encourage everybody to read the labeling on there. Sometimes, you're not able to put an inhaler in there or any kind of injectables in there. So always just read the labeling, but a lot of stores do have these, and it is a safe way to get rid of your medications that you're no longer using. So that's another option. Finally, there's on this screen, there is the other option of the toilet. So pretty much the toilet is reserved for medications that you no longer need that are usually controlled substances. So if you guys have ever heard of Percocet or Vicodin, and you don't need those anymore, we really want to resist people from digging through the trash for those or having, your pet or your grandchildren get a hold of them. So the way to get rid of these is just to flush them down the toilet. So this would be to help prevent any unwanted or, you don't want anybody else to get a hold of those. So that would be a good way or a good place to dispose of your controlled substances. Other ways to dispose of your other drugs. Again, these are recommended for non-controlled substances. So you can mix it with some coffee grounds, and that is one way you can do that. Or you can also mix it with some kitty litter. After you mix it in either of these options, what you do is you put it right in the trash. So this is just another way to get rid of, again, of those non-controlled medications, more of those maintenance medications that you're no longer using, and you want to get rid of them. These are ways to get rid of those kinds of medications. So medication adherence. So why is this so important? So there's a variety of reasons that we're going to go into. So here's some statistics from the CDC that were pretty groundbreaking for us. So about a third of new prescriptions are never filled. And then about 50% of the time, medications are not taken as prescribed. So just a couple of examples of how this can happen. So certain medications need to be spaced out or taken twice a day or every 12 hours or every so many hours for that maximal benefit. That can be very difficult depending on how many medications you're taking. And, if you just weren't sure, am I supposed to be taking this twice a day while I'm awake, or should I be spacing out every 12 hours? Those are good questions to ask your provider when they write you prescriptions. What is the timing? How should I take this first thing in the morning? Should I take this at night? If I'm taking this twice a day, should I, take it twice a day while I'm awake or space it out exactly every 12 hours? I would ask your provider, your pharmacist, for that recommendation. Additionally, we're all human. We miss doses. And, that's why a pill box or, some other mechanism to remember to take those is important. But, you can miss doses, and you don't mean to, but it just happens. So trying to find ways to increase your adherence would be really important, because these medications, as you can see, about 50% of the time are not being taken as they were intended to. And additionally, like Dr. O'Brien had talked about, certain medications should be taken with food, certain medications should be taken without food, certain medications it doesn't matter. Certain medications you might want to avoid certain types of food or drink. So some medications you might not want to drink with grapefruit juice because it interacts. Some medications you might not eat with, a high fat diet. There's so many recommendations and there's so many drugs. So it's always important to ask your doctor or your pharmacist, should I be taking this medication with or without food? Does it matter? What would make it easier on me? What would lessen my side effects maybe if I took it with or without food? And then finally, that last statistic just shows that about 50% of chronic disease treatment failure is from non-adherence. So when we're talking about chronic diseases, we're talking about, things like high blood pressure, things like high cholesterol, like diabetes, like heart failure. Those chronic conditions can lead to failure, or exacerbations of those conditions, or worsening of those conditions just due to non-adherence. So we're kind of going to talk about why it is so important to stay adherent. So missed doses, who do you call? What do you do? What happens? It depends on the medication. Please do not double up unless you're instructed by your provider or your pharmacist on what to do with these medications. It truly does depend on the type of medication, how long it's been. So the first thing you should do is either call your pharmacist or your provider who wrote for the medication, and they can look into that information for you. When you do call them, just a couple things to tell them. Tell them what medication you missed. Tell them what time of day you usually take that medication. And tell them, how many hours has it been since you've missed your medication. Those are just a couple things that, they might want to know, or they may need more information about, just depending on the type of drug. There's no rule of thumb for missing doses. It is specific on, each medication, and they will instruct you on what to do if you do miss a dose. But it would be important to call your provider or your pharmacist to see what to do if you miss a dose.
And that's not that's not a bothersome question or anything. Like, we want you to be able to feel comfortable doing that. I mean, because I get those calls a lot too. So-and-so missed their blood pressure medication. Should they take 2? Should they wait till the next time around? So please definitely call. That is a very good question to ask if that happens.
Yes. So why do we care about medication adherence? So the first one, so we want disease state control or even potentially cure, depending on the type of disease state. So, we take medications to get better or to stabilize, a disease state that we may have. So that's kind of the first reason, why we take medications and why it's important to take medications that you're prescribed, because we want to control what's going on or a certain condition that you may have. Like we talked about, about 50% of failure comes from, non-adherence. So that's why we want to make sure that you stay adherent to your medications to optimally, control the disease state that, you may have. Additionally, certain medications are prescribed for prevention therapy. So a lot of patients may be on medications like aspirin for their heart health, or something that ends in a statin like Lipitor or Crestor, if you guys have heard of those. A lot of patients may be on those for preventative measures. And so it's really important to take these medications to prevent, we don't want an event that is bad to happen. We want to prevent that from happening. So that's just another reason why it is so important to take your medications, again, because we want to prevent anything that could be complicated or could be detrimental to you. And finally, why it's important to be adherent to your medications is to optimize your therapy. So like Dr. O'Brien had mentioned, depending on your disease state, you may be on a certain regimen of drugs. And you don't want your provider to go up on that drug if you haven't been taking it correctly. We want to optimize what you do have, because sometimes adding more medications is not always the best thing for patients. Sometimes we want to optimize or get the best out of what you already are using before we add another agent. So letting your provider know, like, hey, I'm taking this every day as prescribed and my blood pressure is still not controlled, then it would be reasonable for adding another agent. But sometimes before we go to adding another agent, it may be important for the patient, to confirm that, oh, maybe I've missed a couple doses. Let me optimize this drug first before we add on to something else. So that's why it's really important for us, for providers, for pharmacists to look at your regimen to see what we can optimize, because sometimes adding more drugs just complicates the picture and makes it more difficult for patients. So ways that you can increase your adherence. So setting an alarm. So phones are popular. There's applications on your phone now. Even a good old fashioned alarm clock will, if you set a timer or if you set your alarm, this will help you remember your medications. That ringing may alert you to, oh, I was supposed to take my pills this morning. A clock is a very good way to start increasing your adherence. Other ways to increase your adherence are through a pill box. Again, sometimes our days just get so busy we might forget, oh, did I take my morning pills? Well, pill box is a good way to go check to see if you missed your morning pills. So this is a really good way to, make sure you're staying up to date and make sure, by the end of the day, did you complete all your rows? By the end of the week, did you complete all your rows? So this is a good way to increase your adherence. And, a lot of patients do use these. So it's a great unit to use.
And ones like this are nice because they are portable. So you could just like pop out, Monday, and if you're going out to lunch or something like that, take it with you so that you remember to take your noon dose. So
absolutely.
Yeah, definitely look for something like that. If you have, I would say probably in particular, a noon or a midday dose of a medication.
And finally, there's always new medications coming out, and sometimes even old medications that you don't take on a daily basis. It may be a weekly medication or a monthly medication or even every 6 months. So a calendar is a good way to remind yourself, when was my last dose? When should I be looking to do this? And a lot of times when you do have those medications that aren't every day, and your provider asks you, try to pick a day that you'll remember. So, if you always watch football on Sundays or you always play tennis on Thursdays, and that's the day that you'll remember to take this medication that you don't take every day, try to concentrate that on something that you do know that you do that is part of your routine, that you can just incorporate into your routine to make it easier to remember. So a calendar would be a good way on those ones that you don't take every day to remind yourself when your last dose was or when you're due for another dose as well. So other ways to increase your adherence. So take your medications as prescribed. Always read the label. Again, like we had talked about before, don't double up if you miss a pill unless you're instructed by your provider. And it's, we're human. People miss medications, but try to not miss any medications. Really try to utilize, the alarm clock, the pill boxes, or the calendar, or any other way that you can remember to take your medications. If your neighbor calls you every morning, just make sure after you talk to your neighbor, you take your morning pills. So try to come up with a regimen that works for you. Not every regimen works for everybody. So whatever that you can find that works best for you, so that you don't miss your pills, try to use that and incorporate that into your daily tasks as well. Additionally, try to take your medications at the same time each day. So if you have maintenance medications, and by maintenance, for those chronic conditions that you may have, like high blood pressure or diabetes, heart failure, just to name a couple, or even if you're on blood thinners, try to take them at the same time every day. This will also help you, not forget, or if it's incorporated into your routine, it will help increase your adherence as well. And they may be time dependent as well. So, just so you have a stable concentration inside your body, it'd be really important to take them at the same time each day if you can. And then finally, please request your refills before you run out of your medications. So this is really important because sometimes, the pharmacy may not have it in stock. Maybe they ran out earlier that day, or maybe you ran out of refills and your provider, needs a message to resend them back in. Some of this process may take a couple of days, especially with deliveries and making, contact with other providers to see what else is going on, if there's any questions. So, when you need a refill, you make sure you ask, a little bit ahead of time, just so that, we don't lapse in your care. So I think, a couple of days prior, make sure, I have maybe 5 or 10 pills left. Let me just make sure, do I have refills on my bottle? Do I need to call my provider? And then do I need to call the pharmacy to let them know, just so that you don't lapse with your medications? It would be really important for you to request those before you run out. And finally, our big point is to ask questions. Like Dr. O'Brien said, there is nothing that is a silly question, nothing that, takes us forever to get back to you on. Please ask us questions. We love getting questions. It's helpful for you, when you go to your provider's office, write down all of your questions. Sometimes, the day gets so busy and you're like, oh, I should have asked that. Make sure you write down your questions. When you get home and you think about something, write it down, call the office when you're able to, or call your pharmacist when you're able to, and ask the questions. I think it's really important that, when you're starting a new therapy or, if you're on medications, to ask the questions, what are the side effects? What time of day, should I be taking this with or without food? None of those questions are ever too many questions. Please ask us. We always like our patients to be extremely well informed of what they're taking, why they're taking it. In the long run, it benefits us both for you to ask those questions.
Yeah, and I was thinking when she was talking, there's two other questions that I encourage you to ask too, is when can I expect to see this medication work? So some medications, as like a blood pressure medication or something, can work as soon as, hour or two after you take it. But sometimes medications, maybe for your mood or something, would take 4 to 6 weeks to start working. So that's a good question to ask them too, is like, when can I expect to see this? And also, how do I know it's working? So are you going to order lab tests to know? Am I going to feel any different? Like, should I be monitoring myself, blood pressure or whatever? So those are good questions to also ask that I was thinking of when you were talking. So
yes, it never hurts to write them down. It's a good way to remind yourself and to be able to, when you walk into your appointment or you call the provider, to have all of your questions answered right then and there.
And there was one other thing we were talking about, storage. Now that the weather's getting hotter, we want to make sure that we address leaving meds in your car. So
please don't leave medications in your car. Your car can get extremely warm, 90, 100, 110 degrees on these really warm days. There's medications.
The big offenders are
inhalers. Even creams can denature. Pills can be affected, again, like we discussed earlier, by temperatures. Insulin products or any kind of injectable therapies are very temperature sensitive. So, when you pick up your prescriptions and, you're at the grocery store or whatever, make sure, you head home soon, because you don't want to leave them in your car for a very long time.
We've unfortunately had patients not realize that their insulin was left in the car and had to get to work with the insurance to get overrides for new refills because they're just not good anymore. So making sure to keep track of that.
In a good way, things happen, mistakes happen. A good way to solve that problem too is, if that happens, call the drug manufacturer. You can call them and say, can you tell me, I left my pills in my car. Are they good? Are they not good? Do I need to throw them away? They've been in my car for 5 minutes. They've been in my car for 3 hours. The manufacturer usually has some really good data on like storage and stability of drugs. So that may be a good resource if you wanted to utilize that as well.
And I guess kind of dovetailing on that too, if you get any medications delivered via mail order, just kind of maybe checking when your mail is going to come rather soon, so that it's not hanging out in your mailbox all day. But I understand everybody's not home to do that, but just kind of keeping that in mind as well. So so I think that kind of recaps our presentation. So I hope that I see this just us, so we would say open for questions, but I hope you learned something, or at least gave you some ideas of things to write down and kind of keep an accurate list and how to get rid of your medications and store them safely. So
thank you.
Thank you so much, Lauren, and thank you, Michelle, for sharing your valuable information with us today. Once again, we are storing this on our YouTube channel, Wood County Committee on Aging, Inc. And if there are any questions, people are welcome to email us at programs@wccoa.net. And we'd be happy to share those questions with Michelle or Lauren. So thanks again. All the best to you in your future education and being finished so soon. So good luck and thanks again.
Thank you.
Bye now.